Congratulations! Your baby was just born and you've clamped and cut the cord. But now that you've clamped and cut the cord, how do you take care of it? How do you help it dry and fall off faster? So watch today's video and I'll give you 8 do's and don'ts about newborn umbilical cord care and to help you take care of it naturally and safely. Go ahead, push like and subscribe to our channel, ring the bell to get notified, especially if you care about watching videos about birth, about postpartum, and about breastfeeding. And we release new videos every Friday. If this is our first time meeting, my name is Maria Chedri. I'm a midwife and an herbalist. And as a midwife, I've helped hundreds of babies be born at home. And as an herbalist, I've created an herbal line called Botanicals. We make nourishing herbal remedies to support pregnancy, birth, and postpartum. And you can find out more about us on our website at birthsongbotanicals.com. All right, let's get into this. So, natural umbilical cord care. I'll admit it, the umbilical cord at first glance is a little bit gnarly and a little bit intimidating. I mean, you have this piece of flesh that's sticking out. The first day, there is probably a plastic cord clamp on there, and then within the first 24 hours, the clamp is removed, and you have this piece of flesh, and you have to take care of it, and you don't want it to get infected. And the thing that people say about how to take care of the cord, sometimes those suggestions and inputs, they change over time. So what is the first thing? I have very simple, straightforward tips. You're going to be like, oh, this is easy. I got this. I'm a good mom. I can do it. Right? Exactly. That's exactly how you're going to feel when you watch this video. So the first thing with this umbilical cord on my little pretend baby here is don't mess with it. Leave it alone. Like, don't pick at it. It's tempting to touch it and check on it and make sure it's okay. So tip number 1 is just let it be. Don't mess with it. Okay, number 1. One thing I want to say before we go further is just have realistic expectations. It's going to take 3 days to 14 days for the cord to fall off. Okay? So you have 2 weeks that you're trying to not pick at it. All right, the next one is to keep it clean. Now babies, they don't need a lot of baths really, especially in the beginning. They have vernix. You don't want to wash that off. So unless you're taking a postpartum herb bath with herbs that are blended specifically for postpartum recovery, then the baby really just needs a sponge bath, right? And also for the cord, I'm going to lay you down right here, Sophia. The cord, you can, with a clean cloth and with pure water, or even if you want to make it sterile water, you could do that too. You can boil some water and then it's sterile, and then you can clean the area around the cord. You can do it that way. So I do want to say something about postpartum herb bath. I want to go back to that. I have a whole video that you can watch because the postpartum herb bath, you're going to hear over and over postpartum as a new mom, don't take a bath and don't put your baby in a bath. And I want you to know that this bath is really special. It's a unique bath. So you'll want to watch those videos and get really informed so you can take charge of your care, of your health care for yourself and for your baby. Okay, so the next tip is number 3, and that is keep the cord dry. So to keep the cord dry, if you even sponge bath it and you see that it's wet, you can blot it and keep it dry. You can expose your baby to room air or indirect sunlight. So if the temperature is a good temperature and it seems okay, then take off the clothes, take off the shirt, and let the umbilical cord and the baby's chest be exposed to indirect sunlight, because sunlight is an excellent healer, and the vitamin D in the sun is going to help boost the immune system, but the sunlight is going to help dry the umbilical cord, right? And the vitamin D is going to have an added benefit of helping your body process, helping the baby's body process the extra bilirubin levels, and it'll help clear out the jaundice. So letting the cord air dry in the sunlight. Also, don't let the cord stay wet. And what I mean by that is keep the cord out of the diaper. So that goes to tip number 4. So tip number 4 is avoid irritating the cord. So if you have cloth diapers, those big old cute cloth diapers, and you have a little baby, you're going to have to get creative on folding the cloth diaper down, right? And making sure that the Velcro doesn't irritate the baby's umbilical cord. You could consider using disposable diapers the first week because they have the little cutout, and you can use the little cutout, or if you don't have the special diapers with the cutout, just use some scissors and cut out a U shape for the umbilical cord. The other thing about not irritating the cord is think about what you're going to put on the baby. So a nice like sweet pea, they're like nightgowns, those are really good, versus a onesie with the snaps near the crotch. That's a little bit tight and irritating maybe for the cord. Or a pair of pants that just collects right here at the waistline. That's really irritating for the baby. So until the cord falls off, maybe consider using a pullover sweet pea to keep the baby cord from being irritated. All right. So I want to hear from you. So far, when you're looking at your cord, what has been your biggest challenge of taking care of the cord? What makes you worried about it? What's your biggest concern about taking care of the cord, and what problems have you come across? Okay, tip number 5 is using herbal cord care powder. So herbal cord care powder is a blend of herbs that are antiseptic. That means they're antimicrobial, they're antibiotic, and they're antifungal. These herbs are, you've heard of them, myrrh, lavender, yarrow, Oregon grapefruit. All of them, calendula, all of them are really good at drying up wet things, preventing infection, and the myrrh and the lavender have a wonderful smell. Because it's true, what I said in the beginning, the umbilical cord is a little gnarly. What I mean by that is really, let's be clear, it's a piece of flesh that's rotting away and gonna fall off. So it doesn't smell good. And it has oozy wetness around it, right? And then when it gets irritated and touched, it just it wants to fall off. And so you want to help it fall off. You want to help it dry, and you want to help it fall off faster, and you want to improve the smell. Cord care powder. So when you get your cord care powder, there'll be a seal on the inside, and then this dispenser is pretty nice because you can keep it really clean. So what you're going to do, I'm going to keep this closed for the example, but what you're going to do is you're going to tap the base of the bottle, and you're going to direct the powder to go around the umbilical cord stump. If this is the first few days and the cord is still kind of wet, then you're going to douse the entire cord with the cord care powder and even kind of like massage it in a little bit. And then the wet part of the cord will dry. And then within the next day, it'll just get wet around the edges. So you'll sprinkle the cord care powder around the edges, and if you need to, you can use a Q-tip to direct the cord care powder. Because what you want to do is you want to pack it in there. And what'll happen is the cord care powder will help this stump turn into a scab, right? And when it turns into a scab, the scab will shrink and shrink and shrink, and then at every diaper change is a perfect opportunity to assess your cord and see what you need to do with it. And at every diaper change, if you start to see that the scab is shrinking and it created a new space that's getting wet, just go ahead and pack that area with the cord care powder, and before you know it, the cord will fall off. I mean, I've had thousands of people use the cord care powder, and they report to me that the cord falls off within 2 to 5 days. The thing is, I want to say is, this typically works so well that you will not use all of the cord care powder. There'll still be some in the bottle before the cord falls off, right? So you'll still have some left over. So keep this and put it in your Herbal first aid kit. And it's really great for cuts and scrapes and burns and all sorts of little bug bites and wet, oozy infections. Okay, tip number 6 is you want to understand the natural healing process. Like I described, it's going to take potentially 3 to 14 days. The cord care powder is going to exponentially shorten that time. However, once this cord falls off, there still might be a little bit of bleeding. There might be not a lot of bleeding, but like spotting or little spots of bleeding. You might see it in their diaper or on their onesie. And that's part of it. That's normal. Just go ahead and keep doing what you were doing. Keep it clean, keep it dry, and keep adding your cord care powder. Okay? The other thing I want to say about this natural healing process is people ask me all the time, oh, is my baby going to have an innie or an outie? And the truth is, we don't really know, so you're just going to have to wait and see. However, we do know that as the baby grows and gains strength, like it can lift its head and starts to like move around and kick their little legs, and they're all so cute and moving their legs and kind of being strong, right? As they strengthen their abdominal muscles, that's what pulls the umbilical cord in. And so as they get stronger, you'll notice the umbilical cord changing. But there's no correlation to how they clamped and cut the cord to determine if you're going to have an innie or an outie. Okay, tip number 7 is please don't do these things. These are the things to not do. Number 1, doctors told us, everybody believed it was true, we used to apply rubbing alcohol onto the umbilical cord. Please don't do that. It's way too harsh. It's damaging on the tissues, and it's freezing cold. So when your baby's crying, it's crying for a lot of reasons, right? Don't use the alcohol. The other thing is traditional cultures or indigenous cultures used to really care about if the baby's going to have an innie or an outie. So what they did is they would put like a coin or a piece of metal or something flat onto the umbilical cord and wrap it up with a faja. Like I said, we don't really know what causes innies or outies, but we do know that placing metal or coins on the umbilical cord, it could promote infection. So we know not to do that. So please don't do that. I will say that if you feel like you want to put a faja, but that means a band, like a wrap, a belt, a way to wrap and secure the belly button, and so that it doesn't get irritated, I suppose you could do that as long as it was clean, I mean by when I say clear, and that it's dry and that you allow air time and that it's not too tight. So if you're going to do that, and that's important to your culture, really go back to the basics. Clean, dry, airtime. Okay, the last little piece. We've already made it to number 8. See how easy this is? Number 8 is infections are really rare. They hardly ever happen. However, if you start to see any of these things that I list, you want to contact your care provider right away. Okay, here's the list. If it's swollen or tender around the cord, or swollen and tender in the abdomen somewhere. If there's continuous bleeding, not spotting occasionally, but continuous bleeding, and that if when you apply pressure and it keeps bleeding, right? Call the doctor. If there's a foul smell or discharge, I want to say something. It's gonna smell bad normally. A normal umbilical cord stump, it's going to smell bad and there's going to be discharge. What I'm trying to say is that if it gets worse, you have been keeping it clean, it has been getting dry, the smell and the pus is worse, that's more of a sign of infection. If you see a fluid-filled lump in the umbilical cord, you want to contact a care provider. And if anytime there is a fever of 100.4, you'll want to contact a care provider. And then the last one is if there are signs of lethargy, like the baby's lethargic, they're limp, they're not eating well, right? Those are all signs to get checked out. But really, umbilical cord care, taking care of your baby's cord naturally with herbs, with your cord care powder, with clean water, with sunlight, with your postpartum herb baths. It's really easy. Mama, you got this. All right? You're a good mom. You know how to take care of yourself. You know how to take care of this baby. And I'm proud of you. So go ahead right now, and if I wrote you a book. If you want it, you can get it in the description below. It's an herbal book. It's called The Journey Through Motherhood, and in the links you can download that book. Also in the links you'll find descriptions and about the cord care powder and about the herb bath. Related to those descriptions, you'll also see blog posts about how to utilize these products, like postpartum herb bath. I mean, just think about it. They're for moms with stitches, and if you just gave birth, you might have sore lady parts, and so you want to know about the herb bath to take care of your baby, but also to take care of yourself. That link is down below. And there's another thing I want to say is just how much I appreciate you, and if you like this video, go ahead and share it with your friends. Push like and subscribe. Push the notification bell. It really helps us out. And until next time, my sweet friends, always walk in beauty.